everyone, and welcome to this presentation hosted by the Multiple Sclerosis Foundation. I am your host, Kimani Hendricks, and I'm the Multimedia Communications Coordinator for MS Focus. And our speaker today is Cherie C. Benz, a registered nurse with an additional degree in gerontology, and who is also an internationally certified MS nurse. Cherie is a regular presenter of patient education programs for the Multiple Sclerosis Foundation and a writer for our quarterly magazine. Cherie was diagnosed with multiple sclerosis or relapsing remitting MS in 1994 and has found that adopting some changes in her lifestyle have made her MS much easier to manage. The topic of discussion this afternoon is making the most out of your doctor visit, and we will address all questions and comments after the presentation. Meanwhile, Cherie, I'll turn it over to you, and thanks for joining us.
Thanks, Kamani. About, I would say 20 or 25 years ago, as a tool to get through a doctor's visit and not forget or get sidetracked of the things that I really wanted to cover in the visit, I developed a template sort of that used a letterhead that I had developed that had my contact information on it. And I would modify that template to whatever visit I was going to. So although the title of this is how to make the most of your doctor's visits, I'm going to basically walk through how any healthcare visit could be made easier by using this template. And I see that Casey has just put a link in the chat box for that template that you can personalize to your own needs. So let me just kind of go through and talk about how to use that. Now, I've used it with my physical therapist. I've used it with I always use it with my primary care physician and my neurologist. Any specialists that I have to go to, I use it for that. It can be used for your PA or your nurse practitioner. I even use it for my dentist when I go in and they update my meds annually. So let me just tick in what I start with. You want your contact information at the top of the page. You also want your date of birth someplace in there. It's helpful to put the name of the healthcare provider that you're seeing, whether it's CVS Pharmacy or whether it is your primary care by name or your neurologist. Below that, I guess I would put the date of that visit in as well. If it's your primary, is it for an annual physical? Tick that in. It might help to remind you of some questions that need to be added to that. And then I start out the list with a list of all of the medications that I'm taking by dose, by frequency. Y'all might want to get a pencil and paper because some of these things may be things that you'll look back and you'll say, now, what did she say about this? So if you've got a pencil and paper handy, tick in anything that you think might help as we go along. So as I'm ticking in my medications, I also will highlight either in yellow or change the color of the font to maybe a red or something of that nature if I need a refill called into the pharmacy on those medications. If you're on an infusion for your MS, put the date of your last infusion in there, just so that the provider has kind of an idea of where you stand in that cycle. Also, any supplements that you're taking. Most of us are taking vitamin D. Be sure to record how many units you're taking, whether you're taking it weekly, whether you're taking it daily, as well as any over-the-counter meds. Those of us that suffer from pain related to MS or injuries or aging or anything like that often will take an over-the-counter pain medication. And it's generally helpful to tick that in too, because a lot of the over-the-counter medications will have side effects of maybe increasing our bleeding time. So if we need to go on a blood thinner or something like that, that may need to be adjusted. Things like Tylenol, if you're taking much of that, can actually impact your liver enzymes, and a lot of our disease modifying therapies also are processed through the liver. So that could be a strain that maybe isn't caused by your disease modifying therapy, but could be sort of enhanced by the Tylenol that you might be taking. So all of those things are very, very important to take in. Now, if it's your first visit with any provider, also be sure to make a list of your allergies. Allergies are not just things that you've had effects from that you're not liking. Like if something gives you a stomach ache, that's not an allergy. If something maybe gives you a headache, it's not necessarily an allergy. An allergy is usually determined as something that causes hives or shortness of breath or your throat closing off or anything like that. I took a medication one time that after the third dose of it, I developed a total body rash, and that was determined to be an allergy. And that rash stayed with me for nearly a week because the medication took that long to clear from my system. So be aware of those things in your past history that might have been a sensitivity to something. If there's an underlying condition that you have, such as high blood pressure, or maybe you're diabetic, be sure to take your blood pressure logs when you're checking your blood pressure at home, just to be sure that the medication that you're on is keeping it well managed. I actually did that for about 6 or 7 years before I had to go on to a medication. And just the fact that I took that into my visits saved me several years of taking medication that maybe wasn't quite necessary yet at that time. Same thing with blood sugars. If you're pre-diabetic, and you have the ability to check your blood sugar regularly, keep a log of those blood sugars, the times of day you took them, if they're near a meal, and take those logs with you to your doctor, because that may make a big difference in whether or not you're sent for dietary counseling or ways to lower your blood sugars or your A1C so that you're not transitioning into diabetes quite as early. Those things are all very, very helpful. If you know that your doctor orders labs annually or quarterly or whatever to track your medications, and you know that you're near the end of that cycle of the labs being actually usable, then you just tick in need new slip for quarterly labs, or I haven't had an MRI in a year and a half. Is it time for one? Need another MRI? Those sorts of things. After I've listed all of the medications and the supplements and the over-the-counter meds, then I go to a list of concerns. Now, you may have a ton of concerns when you get ready to plan your visit. That said, realistically, you need to sort of lump concerns into a bucket. If there are several things that seem to make sense to bring up a question about, I'm waking several times at night with pain. Is it spasticity? Is it bursitis? Is it a strained muscle? What is it that's causing it? So I think a concern along those lines would be something to the effect of sleep is poor because of pain. I wake frequently. And then you might just put a question mark after the spasticity, injury, MS, question mark, and let the doctor kind of work that out, or your nurse practitioner or whoever you're seeing at that visit. If you've got questions about that spasticity or that pain, you're taking baclofen or Xanaflex already, tizanidine, then, and maybe you've heard from somebody that a baclofen pump helped them. You may want to bring up that concern or question. This doesn't seem to be managed well by baclofen. Should I consider a baclofen pump? Would you please talk to me about that? So make sure that your concerns are dealing with that specific visit, and 2 or 3 at the very most for the visit time. And then you want a list of questions after your concerns. And the questions have to be related to those concerns so that you keep things on track. Like that question of the baclofen pump. Would my spasticity be better treated with a baclofen pump? Please talk to me about that. Or should I maybe see a physical therapist to manage this pain? Those are the sorts of things you want to have, those two sections, your concerns and your questions, relating to each other so that it keeps the visit totally on track. Now, I make 2 copies of this sheet when I go to a visit. I give one to the provider that I'm seeing, and I keep one, just so that it helps both of us to stay on the same page, quite literally, as far as the focus of that visit. Too often in the past, I think we've gone into a visit and just sort of sat in that chair or sat on the exam table and said, okay, what do you need from me at this visit? Rather than the other way around. We need to be sort of in the driver's seat in that visit and let our provider know what we need from that visit, and not just let it go sort of organically. We can drive that. There's really no point in us making that appointment and going to the visit if we're not willing to commit to conveying what our needs are and listening to what our provider is giving us back related to those needs, and letting that interchange take place. Let them teach us, let us teach them through that encounter. Also, I would recommend that at the start of that relationship, and if you haven't started it by now and you've been in the relationship with your care provider for a period of time, find out what the best way to communicate with them is. Now, I've got my neurologist, basically for years has just left me with his email, and frankly, when I email something to him, he's generally back responding to me by the end of that day. Even if it's not anything that's urgent, he will generally get back to me. But it varies from provider to provider. So find out, do they want you to communicate via email? Do they want you to call the office? Do they want you to send them a text? Do they want you to communicate only through the portal? Find out with each practice that you're going to how to do that. Another thing I just want to bring up with the portal, if you've had lab work done, if you've had an MRI done, and you haven't heard anything from the office to say, oh, we've got the results and they're fine, don't assume that they're fine. There have been many a time when I've been waiting on labs, waiting on a call from the office, and I've not heard anything back. And then I've gone into the portal and I've checked, and the results have been there for several days and I just haven't noticed them. So check your patient portals regularly. If you don't understand what the results mean when something comes in, certainly call your office or type in a message through the portal and ask about it. A lot of times, if you've got a team caring for you and you have lab work done, they may put the doctor that they've got in your computer as the prescribing physician, and when in fact they're not the ones that have prescribed. And I have that frequently when I go in for lab work, because I've got one doctor that orders my infusion and my port flushes, and when I go in to have my port flushed, they'll draw my labs, but another doctor's ordering the labs. So sometimes that doctor doesn't always get the labs without going into the portal and looking for them. So if they're not there after, I would say, maybe 3 or 4 days, then certainly go check for them. They could be actually sitting on the desk and not published to the portal because they haven't been reviewed yet. So don't be timid about reaching out and asking for things like that. Also, one thing I want to caution you on is don't go to social media if you don't understand what something means. So many times I see people post their MRI reports on social media and say, what does this mean? Does this mean my MS is getting worse? It says here, it looks like we've got demyelinating disease. Does this mean that I have MS? People on social media are not medical experts for the most part. And you really need to be having those conversations with your healthcare provider and not on social media. So just some things to be cautious about. I reached out to several providers about this conversation today and what, if anything, that they would like presented. And Dr. Ben Thrower at the Shepherd Center in Atlanta said that he really appreciates it when his patients who are using cannabis for medical reasons include that in their medication and supplement list. What strain are you using? How many milligrams in that strain? What are you using it for? What kind of benefit are you getting? Those sorts of things are things that probably 70 or 80 years ago were very commonplace. Our healthcare providers knew what cannabis products did, what they were used for, the types of symptoms that they could be relieved. And back in the late 1930s, when hemp products and cannabis products were outlawed, we kind of lost all of that. So we need to retrain ourselves, and we need to retrain our providers as to what these things are doing and how effective they are, so that our providers also know better what to recommend to people. So be sure, if you're taking sativa at bedtime, that you say how many milligrams, what's the difference in your sleep quality? How long are you getting a good sleep before awakening again? Those sorts of things are very helpful to add to the knowledge base for all of us. Another thing that Dr. Thrower said is, when you've got a telehealth visit, be sure that you're not doing that visit while you're driving your car. He's had several patients report in for telehealth visits while they were driving. And that's distracting to you, it's distracting to your provider, and it's frankly very, very unsafe. You could be in a collision because your attention is on the visit itself. I talked to one other provider who said that she actually went into a telehealth visit with a woman who was in the mall, and she just sat down at one of the benches in the center of the mall to carry on. That's a very unprivate place. It's a noisy place. It's a distracting place. So make sure that with your telehealth visit, you're in a quiet room. You're not distracted. There aren't other people around unless you have somebody with the visit, going to the visit with you. Dr. Megan Weigel suggested that if you are in a telehealth visit, that you place your camera in such a manner that your whole body can be seen or evaluated. Now, that's kind of hard when you've got a cell phone that's your camera, unless you've got somebody in the room with you that can hold the phone and direct it to certain areas that can be then assessed. For example, if they want you to walk, if they want to see how your gait is looking, have somebody else hold the camera while you're doing that. Dr. Derek Smith in Connecticut said to me that he really appreciates it when people check their connection in advance of the visit, just to make sure that they're not having problems. 5-10 minutes before your appointment time, check. And if you're not able to get online, that gives you time to call the office and get some technical assistance with that. He also said that I should encourage all of you to please, once you log in at the time of your visit, do not leave the room. Don't go away from your camera and microphone until your provider gets there. They may be signing off with another patient. Sit tight, stay put. The telehealth visit will continue. You just need to stay on track with that. Now, another thing that has come up lately in a couple of conversations is the fact that some of us may have some food allergies or some sensitivities to things. And a couple of the big things lately are, I'm seeing more and more people that are allergic to corn. I thought I was kind of unique, where corn actually makes me very itchy. antsy. It causes my contacts to goop up, and I actually have an uncomfortable gut with it. And I found out quite by accident, maybe 15 years ago, that a generic medication that I was taking all of a sudden stopped working, and I started having some nasty side effects after I took it. And it turned out that the manufacturer was using cornstarch as a filler in that medication. Cornstarch and lactose, which is a milk product, are often found as fillers in many of our over-the-counter medications or in generic medications. Fortunately for me, at the time of that medication reaction, the pharmacy was putting the name of the manufacturer on the pill bottle label. And I sat down with our pharmacist, and he actually targeted 3 different companies that they had on the shelf that had those fillers in them. And so a note was put in my electronic record not to use any of those companies for that medication. So if you do have any of those types of sensitivities to food or to substances, do take some time, sit down with your pharmacist and review all of your medications, have them do a little bit of research on what companies use those as fillers or additives to their medications so that you can avoid taking those and avoid additional problems. I think I've covered the key points of what I wanted to cover with you, but that form that we brought up at the beginning of the conversation today, remember Casey put a link to that in Google Docs in the chat if you're on Zoom. If you're not on Zoom, if you're on Facebook, feel free to go ahead and send an email to Casey. It's KASEY @msfocus.org and ask for the visit form, and she will email that to you. So Google links in the chat box. And I think, Kamani, we had a question come in.
Yes, we did. So before I get into the question, I would like to tell everyone who has a question or a comment how they can speak with you. You can either use the raise hand feature at the bottom of your screen or type your questions into the chat or Q&A box. If you do have a question and you prefer to remain anonymous, that feature, you can take advantage of that in the Q&A feature. You would just select the option to remain anonymous. But the question that was sent to us via email came from a gentleman named Ben. He says, I was diagnosed with MS in 2017. My initial neurologist moved to another state, so I got a referral from my current doctor in 2018. The doctor-patient relationship seemed fine up until the past 2 to 3 visits, and then it began to feel strained. I was questioned about how she had inherited me as a patient, told sternly that I was welcome to get a second opinion about a treatment, and I constantly had to chase down test results. So my question is, when is the best time to change neurologists, and how does one go about doing that?
Okay, I don't know that there's necessarily a best time across the board. I think if you're feeling uncomfortable, and if that kind of dialogue is going on between you and your doctor, where the doctor's questioning why she inherited you and you're not feeling supported or judged, if you're feeling judged, or if you're feeling like you've become a burden in the practice, then it's probably time to move. Your friends in your area can probably tell you who's good in the area. I would say if you've got MS, and if there's any possibility that there's an MS center or MS clinic near enough for you to get to it easily a couple or 3 times a year, then you go to that neurologist rather than choosing a general neurologist. If a general neurologist is all that's available, ask how many MS patients they have in their practice. Certainly, if they've got 100 or more in their practice, they're probably keeping somewhat up on latest measures to treat and and care for you. But I would like to see you, if possible, in an MS practice per se. I know a lot of people that in order to do that will take a couple of days off. They'll drive 8 hours and see a neurologist, spend the night with friends or in a hotel, and drive the 8 hours back home. If you've got a good neurologist that you've had in the past and they've moved, a lot of people will stay with that neurologist and just travel if they're able to. That said, that's not reasonable for a lot of us. A lot of us rely on public transit, so we're a little bit hobbled when it comes to seeing somebody that's not on a public transit route. That said, the Multiple Sclerosis Foundation has a Lyft and Uber program, so they will provide transportation for you and a care partner to go to doctor's visits if need be. You can send an email to support@msfocus.org and find out about that program. And the other thing is that the National Multiple Sclerosis Society has a physician directory of doctors who are treating patients with MS. So you might want to go to their directory and ask for that, see if you can find somebody in the area. Your insurance company is probably also a good resource for that. You can have them you can call the customer service number on the back of your insurance card and ask them if they know of any neurologists that treat MS that are covered by your plan. So there's a number of different routes that you can go. You can certainly tick something into the social media pages. The Multiple Sclerosis Foundation page often has people asking, is there an MS doctor in the Little Rock, Arkansas area, or in the Boise, Idaho area, or whatever. So wherever you are, tick that into our Facebook pages and you'll have people popping out of the woodwork with suggestions.
You did mention our transportation program, and if there's anyone on the call who does not know what that is and would like more information, as Cherie said, you can email support@msfocus.org, but you could also visit msfocus.org, and there is a grants and programs tab at the top of the homepage, and click transportation and it'll tell you all about it. Also, in our spring issue that's coming, that'll be published in a couple of months, there's going to be an in-depth profile on that particular program. So I am looking in the chat and I do see a question from Casey. She said, what do you suggest when the doctor is great, but the office staff is unhelpful?
I try to keep my, again, that's one of the reasons why I have the email from my neurologist. When I brought that up to him, he recognized that there was a problem with somebody who was getting near retirement and didn't want to interfere with that. So he said, I tell you what, if there's anything that's really urgent, if there's anything that you haven't had any luck with, just email me and I'll take care of it. So that may be a way to bypass that. Sometimes also leaving messages in the portal might bypass an individual that was problematic with you. I certainly am not going to steer clear of having a conversation with that individual. You know, Mary, I get the impression that there's something I've said or done that's put you on guard with me. Please let me know if that's the case so we can talk about it. You know, it could be that we've said something to them at a point where they were overloaded with something, or maybe we were overloaded or irritable or not feeling well and on guard. It's real easy sometimes when we're in that kind of a situation for us to accidentally or not on purpose say something or do something in a way that offends somebody, and people have long memories. So I encourage you, if you feel like there's an individual that is the cause of that problem, to maybe open a dialogue with them and see if you can't pinpoint when that started and potentially work towards a fix in that.
I agree. We have a question from Facebook, and forgive me if I mispronounce your name, but it looks like Diata. She wanted to know what your opinion was on taking over-the-counter PM medications and whether or not it impacts MS.
I think if there are no other problems, it's probably okay. I wouldn't get into it on an every night basis. Um, Things like Benadryl, or diphenhydramine, which is the primary ingredient in most of the over-the-counter evening medications, medications for sleep, ZQuil, not NyQuil. NyQuil is for colds, but there's a number of different medications for sleep that use that as a primary medication. If you have high blood pressure, it could raise your blood pressure. It also has the tendency to be sedating during the day. So that's why I would recommend that it not be an every night thing. I recommend too that if it's possible, start it out on partial dose. Some of the liquid formulations allow you not to take the full dose as you'd have to with a capsule. So that you may be able to take a partial dose and see if a partial dose works, because less is sometimes more. A lesser dose you may be able to take over a longer period of time with better effect than taking a full dose and ending up having it stop working for you altogether. So I don't think it's a bad thing. I would rather see you do something like that than get onto a sleeping pill, for example. But as far as sleep is concerned, you need to also be looking at your sleep hygiene. You need to be looking at screen time. Unless you've got a blue light filter on your screen, you should be off your screen for a full hour before going to sleep at night. No watching TV in bed. Bed is for sleeping and for sex, and that's it. Your reading should be done in a chair, not in bed. You don't want to put yourself in a position where you're reading and you get so involved in what you're reading that you can't put the book down and turn off and go to sleep. The bed is for sleep. Your room needs to be dark. So I know Dr. Weigel says, unplug your alarm clock. Just get rid of that extra ambient light. Don't rely on waking up and looking at the clock every time you wake up. So there's a lot of little tips that you can do to improve your sleep. We do have, I believe, a webinar that Dr. Weigel did on sleep and sleep improvement, in which she talks about those things. So before you start just popping a pill for sleep, read up on sleep hygiene, watch some of the videos that we've got on our YouTube channel, and see if you can't get some tips that can be lifestyle changes that have a longer benefit than just taking a medication to get to sleep at night.
Yeah, then you have people like me that are completely backward. I have to sleep with the television on or some kind of
white noise.
Like, yeah, there has to be something. I'm falling asleep to the Twilight Zone most of the time. But we do have a question in the Q&A from David. He says, is it normal for my neurologist to not know whether or not I have relapsing remitting MS or primary progressive MS?
Absolutely. At the beginning of the course of MS, your doctor has no idea if you're anything other than relapsing remitting. All people start out with a relapsing remitting MS diagnosis. If, for example, the only difference for that would be if you have been in the diagnostic process for a number of years. That's not really happening anymore with our current diagnostic criteria. I was diagnosed 19 years after symptoms started. I know of a woman who took nearly 21 years to be diagnosed. Those of us who are on that track sometimes could be told we have primary progressive MS. Now, the difference between primary progressive MS and relapsing remitting MS is that with primary progressive MS, we start declining right from the beginning. We never really get back to our normal. With relapsing remitting MS, we have an episode that maybe has us down for the count or even off and not functioning at our best level for it could be weeks or even months. And then gradually we improve, or we wake up one morning and we are back to feeling fine and functioning fine. That's the nature of relapsing remitting MS. Over time, if not on a medication to manage the MS, what we call a disease modifying therapy, those episodes happen more and more, and we don't get back to normal. With those disease modifying therapies, we relapse less, we have less downtime, and we transition to secondary progressive MS a lot less quickly, sometimes not even at all. I mean, there are patients that have been on disease modifying therapies for 25 years and have not transitioned to a progressive form of MS because they're on disease modifying therapies. Before the disease modifying therapies came on the market in 1993, people were transitioning an average of 10 years after the onset of their first symptoms, and they're not happening anymore when you're staying on medication. Primary progressive MS, however, never has those relapses and recurrence or, rebound. It's just a downhill. So they really kind of have to watch you for 3 or 4 years before they know that you're primary progressive and not relapsing remitting.
I dropped in the chat the link to Megan Weigel's Zoom presentation on sleep that you referenced before our last question. And for those of you on Facebook Live, the conference is called The Symphony of Sleep, and it's on the Multiple Sclerosis Foundation YouTube channel, and it's dated for June 2020. That was a while ago, but I do remember that one well. There is another question that popped up in the chat, and it says, do you think lifestyle changes also help slow disease progression?
Oh, I never would have thought it. I never would have thought it until about 15 or 20 years ago. I say that my first episode with MS that had me in the hospital was in 1975. I was not diagnosed officially until 1994. And it wasn't until after I started seeing my current neurologist in 2001 and finally got on a disease modifying therapy that I went on one of the foundation's educational events, one of their first cruises that are educational events. And Dr. Thrower started talking about high dose, high frequency disease modifying therapies. At the time, we only had 3 or 4 injectables on the market. Some of them were only once a week, some of them were daily, some of them were low dose, some of them were higher dose. And also at that same event, we started hearing how diet and how exercise could change the course of our MS. And I come from a family that is so sugar oriented. I grew up on a big dairy farm, and we had probably 6 meals a day with something sweet at each meal, because we got up at 4:30 in the morning to milk the cows, then came in and had breakfast. We had coffee and donuts when we went out in the morning to milk the cows. We had a coffee cake or donuts after breakfast. We had our main meal at noon with generally a pie. Before we went out to do the milking again, and late afternoon, it would be another pastry and coffee, be a dessert with supper, and then before bed. So there was a lot of sweet, and I discovered sugar is just so addictive. It's as hard to get off of sugar, I think, as it is to get off of a long-term opioid. I mean, I've been on codeine for years, a long time ago, for migraines, before some of the better migraine headaches came on the market. And it was really hard. I mean, the sweats and the abdominal cramping, and getting off of sugar can do the same thing. But boy, after a month off sugar, things taste too sweet to me. But I began to wake up. I wasn't as fatigued. I wasn't dragging my knuckles all the time. My pain was less. And then I started with some attempts at determining if I was sensitive to certain food groups, like dairy. Dairy farmer can't be allergic to dairy, right? Yeah. Again, the food allergies don't necessarily look like GI symptoms. They may be itching, they may be a rash, they may be incredibly dry skin, they may be pain. So each individual needs to find if there are foods that they're eating that are not helpful. Preservatives, pre-made processed foods. I used to do, it was a stuffed chicken breast that I'd pull out of the freezer when I wasn't doing real well, pop in the microwave and heat it for dinner. And I always felt worse after those. Once I did away with preservatives and additives and started making everything from scratch, a lot of those went. A lot of my spasticity disappeared, pain let up, my sleep improved, my cognition improved, my energy improved. And then you add exercise to that and you build up an endurance, and it really can change the whole picture. It certainly did for me. So there's a lot of little changes that you can make that cost you nothing except your time and your commitment.
Yeah, and wellness. I mean, my mom deals with pain regularly. She doesn't have a chronic illness or anything, but she likes her salt. She likes her meats, and she'll kind of binge for a long time, and then she'll stop because she can barely move, and it's very painful. And she becomes more active and mobile when she realizes that, okay, I have not had any salty foods for a month. I feel great. So like, mom's doing it to stop eating it, but it's addictive. Salt.
You know, each of us is different, and we just need to find our stride. We need to find what doesn't agree with us and just make a decision. This isn't a diet. This is a permanent lifestyle change. Not to say that on a rare occasion you can't indulge, but boy, I find when I do that, when for example, the holidays hit and people start bringing over cookies, that's a temptation, but boy, I'll tell you, it hurts when you do that.
Yeah. I'm a sugar holic too, so I get it. I want to cry when I know that I want to indulge, and I just turn away. But Desiree from Facebook says that sugar is definitely addictive, and she asks, what did the people use as sweeteners before white sugar? Fruit sugar?
Before white sugar, raw sugar was used often. So it's less processed. Brown sugar is even less processed than that. Molasses is even less processed than that. You can use honey or maple syrup as natural sweeteners. And they're not as bad as sugar for you. And yet, you know, the whole point of this is to get away from the sweet. So you wanna sort of train your body not to need it as often or to the degree that you've been giving it. So it's a weaning process. Natural sweeteners like stevia are probably better than things like your extra or couple of there's several sucralose, the sweeteners that come in the purple and pink packets, yellow packets. Don't even remember the names of them anymore. I used to keep them in the house for guests, and we haven't had guests in a couple of years.
Desiree adds that I find high fat and high sugar in large quantities, I feel internal inflammation.
Yeah, you know, I've been saying for a few years that I feel inflamed, And doctors oftentimes don't know what I'm talking about. So Desiree, I would encourage you to find words that describe what that internal inflammation feels like to you and be able to convey them to your doctor or to a friend that you see is struggling with many of the same things that you are. When I feel like I'm internally inflamed, it feels like this. So those words can help others. And I encourage each of you to be in tune enough with your body that you can feel that and recognize it.
And I don't see any more questions in the chat or Q&A. I know you can see what I see on, oh, never mind. I see a hand raised, Ruth Ann. I'm gonna lower your hand and you can unmute yourself. I don't know if it was an accident, but I see her hand go up.
Ah, there we are.
There she goes.
Ruth Ann, can you unmute? Lower left-hand corner of your screen, click on the microphone and unmute yourself.
Yeah, Casey, I can't ask her to unmute because you're a host. So don't know if you want to jump in and help her.
Yeah, I've pressed the ask to unmute button for Ruth Ann, so she should get a button that pops up in the middle of her screen that asks if it's okay for the host to unmute her.
I don't know, maybe
Ruth Ann could type her question into the chat box.
Yeah. Ruth Ann, if you still have a question or it was not an accident and you can't seem to unmute, just type it into the chat and we will address it shortly.
Meanwhile, Cherie, is there anything that you'd like to discuss about what's going on with the pandemic and what precautions people should be taking?
Yeah, absolutely everybody must be masked when they're outside of their homes at this point in time. It's just, at this point, here in Rhode Island, we are more than 90% vaccinated, and yet 1 in 5 current infections are breakthrough infections with people that are vaccinated and boosted. The Omicron variant is much more aggressive, much more contagious than anything we've seen to date. And in people that are vaccinated, they're not getting quite as sick, although they still are getting sick. I would say that you have to be masked wherever you are at this point. Stay isolated as much as you can. You have to go to work, you mask when you're at work, double mask even if you're around a number of people that aren't well distanced. My husband thought last night, he said to me, but we're all double masked. There are multiple layers. And I said, no. Double mask means you wear one mask and then you wear another over the top of it. So you might want to, even National Public Radio today they had a health expert from Mass General who was saying that they're recommending basically an N95 mask for everybody, and even wear a cloth mask over that just for added protection. The N95 doesn't block everything. It blocks about 95% of the virus, but not 100%. So the extra mask over the top of that can help. But they stressed that a well-fitting cloth mask is better than a surgical mask that is loose on the sides or the bottom and letting the air escape or get in. So if you really have to be around other people, then it would be a good thing to do that. If you're not vaccinated yet, please get vaccinated. People that have had COVID are not immune. People that have had COVID still can get this variant. So I strongly recommend the vaccine for everyone.
And that's just Jill. She was she was trying to get the links that we shared. She said she couldn't see them for some reason, but she has the Megan Weibel link and the Google Drive link or the Google Doc link. She can get from Casey when she emails it. I don't see anything else in the chat. And Ruth Ann, I don't know. I'm so sorry. Maybe it was an accident. But Casey, do you see anything else on Facebook?
No, Desiree wanted to say thank you for your knowledge and your time.
Awesome. Well, it looks like that's all the time we have for now, everyone. But if you did miss any part of the conference, it will be available for replay from Facebook. Just give it a few minutes after this live stream is over, and it will appear on the Multiple Sclerosis Foundation page. In a couple of days, this video will also be available on our YouTube channel to rewatch, and the audio will be on our SoundCloud and msfocusradio.org pages. And please follow the Multiple Sclerosis Foundation on YouTube, Facebook, Twitter, and Instagram. Follow us on Instagram, Facebook, and Twitter for times and access information. And our next conference will be on Tuesday, January 25th at 3 p.m. Eastern Time with Doctors Adam Chaffetz and Adrienne DeBerry. And their topic will be the changing landscape of MS treatment. And we'd like to thank everyone for attending and for participating. And of course, to Cherie Benz, we thank you so much for the community work you do, for the availability to the foundation, for your availability, and for presenting this important topic today.
And thank you for having me.